Welcome to the deep dive. Today we're diving into something that affects so many people, and yet we don't always talk about it, cataracts.
Cataracts, yeah, it's one of those things, right? You hear about it your whole life, and then boom, there it is.
Exactly. It's almost like you hit a certain age and suddenly everyone's got an opinion on it, a story, or, our story. To really get into it, to give you all the knowledge, the power, right?
Yeah.
We're diving deep into excerpts from Know About Cataracts, a pamphlet by Dr. Sarbjit Singh.
Oh, I've heard of Dr. Singh. He's a consultant ophthalmologist, really respected in his field.
Yeah, he is. He's based in India. And what I love about his writing is how clear and concise it is. He explains complex medical stuff in a way that anyone can grasp.
Which is so key because, let's face it, medical jargon, not exactly light reading.
Right. Like, give it to me straight, doc. So let's do that for our listeners. What exactly are cataracts?
Okay, so picture this, your eye's lens, right? It's like a camera lens, got to be clear to focus light. A cataract is basically a cloudiness that develops on that lens.
So instead of that light passing through nice and cleanly, it gets scattered, making things look, blurry? Is that the main thing?
Yeah, blurry is a big one. You also get things looking less sharp, maybe a bit faded, almost like when a photograph gets old,
Like those old Polaroids left out in the sun too long, everything's kind of yellowed and fuzzy.
Exactly. And what's wild is that this clouding thing, it usually happens gradually over time, and it can even affect one eye at first, or both at different paces. Tricky little things.
Oh, interesting. So it's not like, bam, both eyes, you're seeing double blurry overnight.
Not usually, no. Although any sudden changes in your vision, you definitely want to get those checked out. Don't wait around for that story.
Solid advice. Now, I know we usually link cataracts with, getting older. And I'm sure our bodies doing what they do plays a role. BUT. Are there other things, other causes, aside from just, Father Time doing his thing?
Oh, there are always other factors. Age is a biggie, no doubt. But Dr. Singh, he points out things like eye injuries, certain medical conditions like diabetes, and this one might surprise you, prolonged use of steroid medications.
Wait, hold up. Steroids. Like, what athletes sometimes use? Seriously, I never would have connected those two.
It does seem random, right? It just goes to show you, everything in the body's connected. But yeah, long-term steroid use, it can up your risk.
Wow, the more you know, as they say. Okay, so say someone's noticing some funky stuff with their vision. What are some telltale signs that it might be cataracts developing, rather than just needing a stronger glasses prescription?
That's where Dr. Singh's pamphlet is super helpful. He lays out those common symptoms, and some of them, you might not expect.
Hit me with it. What's got you intrigued?
Well, blurred vision, obviously. Difficulty seeing at night, that's another one. Sensitivity to light, glare. Does those make sense, right? But then it gets interesting.
Okay, I'm on the edge of my seat.
He mentions seeing halos around lights.
Wait, halos. Now that just sounds kind of cool, not gonna lie. Not that I want it to happen, but it's not what I was picturing.
I know, right? It does sound a bit whimsical compared to the other symptoms. But trust me, it's not something you want to ignore. He's very clear. Any of those symptoms, even if they seem small, go see an eye doctor. Don't mess around with your vision.
Absolutely. Early detection is key with pretty much everything health-related, right?
Yeah.
So how do they figure out if it's cataracts?
Well, it usually starts with the classics, the eye chart.
The good old cover one eye, read the tiny letters routine.
That's the one. The visual acuity test, they call it. Basic, but important. But to actually see the cataract itself, they've got some high-tech tools up their sleeve.
So what, you like scan your eyeball with lasers or something, get all sci-fi up in there?
Kinda. They use something called a slit lamp, basically. A super-powered magnifying glass for your eye. They can see the cloudiness, how bad it is, the whole 9 yards.
So they're literally looking at the cataract forming on your lens. That's wild. But what else? They don't stop there, do they? There's going to be more to it. There's going to be more to it, right? It can't just be eye charts and magnifying glasses.
Oh, there's more, all right. They're not messing around when it comes to your vision. Next up, they usually do a retinal exam.
Retinal exam? Isn't that the one where they dilate your pupils? Everything gets super bright and weird for a while?
That's the one, yeah. They dilate your eyes so they can get a good look at the back of your eye, the retina itself.
And why is the retina so important in all this? I thought we were all about the lens today.
Well, the retina is key because it's what senses light and sends those signals to your brain to create the images you see. Dr. Singh explains it's really important to rule out any other issues with the retina that could also be causing vision problems.
So it's like, got to check all the wiring isn't fried back there just in case it's not the lens causing the whole problem.
Precisely. They want to be absolutely sure it's cataracts and not something else entirely.
Yeah.
It's like detective work, right? Got to eliminate all the suspects.
Love that. Okay, so we've got the eye chart, the super magnifier, the retina check. Anything else? What about this tonometry thing I saw Dr. Singh mention? Is that going to be on the test?
Don't worry, it's not as scary as it sounds. Tonometry is just a fancy way of saying they're measuring the pressure inside your eye.
Wait, hold on. Eye pressure. Eyes have pressure. I did not sign up for that.
I know, right? It sounds kind of wild. But it's important. Dr. Singh says that if the pressure's too high, it could be a sign of glaucoma.
Glaucoma, yeah, that's another one of those eye things you hear about but never really know what it is.
Right. Well, glaucoma is serious. It can damage the optic nerve, which connects your eye to your brain. And if it's not treated, it can lead to vision loss, which obviously we want to avoid at all costs.
Okay, yeah, that's definitely something to avoid. So they're checking for multiple things at once during this exam. That's good to know. Like, they're not just assuming it's cataracts and calling it a day.
Exactly. It's all about getting a complete picture of what's going on with your eye health.
Makes sense. So let's say they do all these tests, high tech and all, and it comes back, yep, you've got cataracts. What's next? Is it just straight to surgery or other options, at least at first?
That's the good news. It's not always a one-way ticket to surgery town, especially if you catch it early. Dr. Singh talks about a few non-surgical approaches that can be helpful in those early stages, before things get too serious.
Okay, so there's hope beyond the scalpel. Tell me more about these early stage strategies. Give me something to work with here.
Well, sometimes the simplest solution is the best, right? In the early stages, a simple update to your eyeglasses or contact lens prescription might be all you need. A stronger prescription can sometimes compensate for that mild blurring the cataracts are causing.
See, sometimes a new pair of glasses really eye us the answer. But what if that's not cutting it anymore? What happens then? Do I just walk around with a magnifying glass?
Hey, magnifying glasses aren't a bad idea. Seriously, though, Dr. Singh mentions they can be really helpful for certain tasks, like reading or any close-up work where you need to see those fine details. And it's not just tools. Something as basic as brighter lighting can make a world of difference, especially in low light.
So it's about adjusting your environment a bit, making things easier to see?
Exactly. It's about adapting and finding ways to maintain your quality of life. Keep doing the things you enjoy, even with the cataracts. And, those strategies can buy you some time before considering surgery.
That's reassuring to know that it's not an immediate, you need surgery now, you're Emma situation.
Yeah.
But I imagine there comes a point where even those adjustments aren't enough anymore. Like, when do you know it's time to seriously consider the surgery route? So you're saying there's this tipping point where those lifestyle changes aren't enough anymore, and you have to think about the next step.
Exactly. It's about, I guess, how much it's impacting your life, and that's where surgery comes in. Dr. Singh's really clear that while those other things can help, surgery is the most effective treatment.
So when you reach that point, when it's surgery time, what can people expect? I'll be honest, the whole idea of eye surgery kind of freaks me out a little.
Oh, I get it. I totally get it. It sounds scary, right? But actually, cataract surgery is way more common and way less intense than people think.
Less intense how? Like, what, did it just numb your eye and you're awake for the whole thing? That's what I always imagine, and that does not sound fun.
You're not wrong about the numbing part. They do use local anesthesia. But here's the thing. Dr. Singh says most cataract surgeries are outpatient procedures.
Outpatient, meaning you don't have to stay overnight at the hospital.
Exactly. You go home the same day. It's become a really routine procedure.
Wow, see, that's not so bad. I had no idea it was that streamlined. What about recovery time? I imagine you're stuck with blurry vision for a while, right? Wearing those super stylish eye patches.
Well, you might need an eye shield for a bit, just to protect your eye while it heals. But the recovery is usually pretty quick. You might have some mild discomfort, some blurry vision, maybe sensitivity to light for a few days.
Okay, so not exactly a walk in the park, but not a horror movie either.
Exactly. And Dr. Singh says most people are back to their normal activities within a few days, and they see a big improvement in their vision within a week or two.
Wow, that's amazing to think you can go from blurry to clear vision that fast.
Yeah.
Makes you realize how life-changing something like this can be, even if it seems routine.
It really is. We take our vision for granted, until it starts to go. But it all comes back to what we were saying earlier. Early detection is key.
Absolutely. So if you're noticing changes in your vision, no matter how small, don't brush it off. Go get it checked out.
Couldn't agree more. And, even if it's not cataracts, there might be something else going on that your eye doctor can help with. It's always better to be safe than sorry, right?
100%. This whole deep dive into cataracts with Dr. Singh's insights has been amazing. It really makes you appreciate the importance of clear vision and proactive eye care.
It really does. It's one of those things we don't think about much until it becomes a problem.
So true. Well, on that note, we'll wrap up our deep dive into cataracts. Thanks for joining us, and until next time, keep exploring, keep learning, and most importantly, take care of those precious peepers.